The next suture will be simple continuous suture. So as we had seen in simple interrupted suture, we will again take the first bite from the buccal aspect. The next bite will be taken from the palatal aspect. And similar to simple interrupted suture, we will tie the knot. Then here, instead of cutting the suture, we will continue this in a continuous fashion. So this can be used when we have a long incision, for example in alveoloplasty cases. So again, continuing with the same one, we will take again one more bite from the buccal and palatal. Continuing it over to the palatal aspect, and similarly the whole incision can be closed in this manner. So for ending this suture, when we have taken the last bite, we will just leave a small loop and tie the knot with that. In a similar fashion, how we have tied the knot for other sutures. And the excess suture will be cut. Next suture is the horizontal mattress suture. So first bite will be taken from the buccal aspect. Second will be taken from the palatal or the lingual aspect. Just adjacent to the second bite, we will take our next bite, that is again on the palatal aspect. And last will be again on the buccal aspect, just adjacent to our first bite. So we have to keep in mind the incision distance, the distance from the incision on both buccal and palatal is same. And then we will tie a knot, 2 throws clockwise, square the knot, 1 anti-clockwise and 1 more clockwise. So this suture is called as horizontal mattress suture, and we will cut the excess suture.